So thank you very much. Welcome back to the 10th module of AI in Healthcare Education, an initiative by NBEMS. In this session, we have two distinguished guests who are going to take us through this module, which is when to use AI rationally in medical practice. It is my distinct honor to introduce Dr. Rahul Kashyap, a physician scientist, educator, and leader whose work exemplifies excellence in clinical research and innovation. Dr. Kashyap serves as Medical Director for Research at WellSpan Health in York, Pennsylvania, and he is an Associate Professor of Medicine at Drexel University College of Medicine. With over 20 years of experience in clinical research and quality improvement, he has made an extraordinary impact on advancing evidence-based medicine with more than 300 PubMed Index publications. His academic journey reflects a commitment to lifelong learning and leadership, including advanced training through Global Clinical Scholars Research Training Program at Harvard Medical School, an MBA from Augsburg University, and recognition as Fellow for Critical Care Medicine. He also continues to contribute as a supplemental research scientist at Mayo Clinic. Welcome, sir. And to moderate this session, we have Dr. Devyani Mishra. Dr. Mishra is a physician scientist at Beth Israel Medical Center and an assistant professor in medicine at Harvard Medical School. She is a dual fellowship trained. She completed her geriatric fellowship at the Harvard Geriatric Fellowship Program and rheumatology fellowship at Boston University. She is a trained neurologist, completed Masters in Science in Epidemiology from Boston University. She also completed a course in AI in Healthcare from MIT. Her research focuses on understanding the risk factors and geriatric outcomes in rheumatic disease, for which she has received peer-reviewed funding. She has contributed extensively in developing educational contents on aging-related topics through book chapters, didactics, online educational platforms, and organized study group meetings and symposia at American College of Rheumatology annual meetings for over a decade. Welcome to Dr. Rahul. Please let our viewers know what you are exactly going to take us through.
Absolutely. Thank you so much for the kind invite and introduction. I'm very excited to be giving this talk and excited that Dr. Mishra is hosting it. My goal is for this talk for 45 minutes is to those who has some experience doing some research or never done any research in this regard. They can learn how to do generative AI or AI-based research, how to evaluate some of those publications coming out in the field as well. It doesn't matter if you are a medical director, doctor, resident fellow, or you are in pharmacy student or nursing student or any other specialty. As far as you have passion for doing research and learning about AI and generative AI, this is your talk for you. I will cover some of my examples of past work where we have done ChatGPT evaluation a few years ago, how good or bad it is when it is come to writing a manuscript or background and so on and so forth. I'll talk about people can do perception surveys, how much ready the workforce is, resident medical students, pharmacy students, nursing students, master students, PhDs, how ready they are from nationally in their department. So share with them how they can conduct those kind of surveys and use the tools what they require to. Then I'll share the example that how they can do simulation studies where they can evaluate Scribe AI or any large language model based things in their clinical practice. In the end, I will share some resources where there'll be some checklists which we have developed and validated, how to read the literature where they are using AI models, and that's called Humane Checklist. And there's some work with my colleagues in Cleveland Clinic, Dr. Piyush Mathur, the Humanely project as well. So this talk should fulfill different criteria. They should come with the curiosity. You should be able to get out some tools to use in your daily life as if you are interested in doing research, or at least you'll have some tools to evaluate these literature coming out that, is it a good paper? Do they do a good validation? Did they use any good derivation validation cohort? And they can evaluate these models. So I'm very excited.
Thank you, Dr. Rahul. Devyani, just please let us know why is it important in today's context that we should be going through such a program? So you have used it, yourself are trained in AI.
Yes, so I personally think AI has penetrated pretty much every aspect of our life, or at least it's penetrating every aspect of our life, and medicine is no exception. There's no escaping AI in medicine, and we might as well just embrace it. But we need to learn how to do it responsibly so that we leverage it for the good and avoid the bad. I think AI is probably most helpful in synthesizing information for physicians. So when I'm seeing a patient in clinic, I'm inundated with the history. There's so much to go through to review the history before I can come to a conclusion about how to treat the patient. And I think that's where AI can be really helpful in synthesizing information, going through the medical records and summarizing it for me. The other aspect of AI, which is already in practice, is documentation. So we are using it in our hospitals for documenting the notes, and it's done in real time where it's converting the verbal exchange into text and documenting the notes. So it cuts down my workload. So the decision making still remains with the physicians, but AI can be a really great tool to help us and offload the workload and the cognitive burden. That's one thing. And for research, there's so many wonderful things that we could do, which I look forward to Dr. Kashyap's talk. I'll be learning from it. From my aspect, developing algorithms to help, for example, older patients who have a million things going on. How do I pick the right, path for management? And I think uh, that would be a very useful method. Or now we are using the omics techniques, right? So proteomics, metabolomics. Now we have so much information. Perhaps AI can be helpful in biomarker discovery, for example. And, algorithms may be helpful in selecting what biomarkers to focus on. And so drug discovery, biomarker discovery. And I think so that's where the AI can be very helpful.
Thank you, Devyani. We are eagerly waiting for your lecture and moderation on 1st of April, India time, 4 p.m. to 5 p.m. Please do join us.